Hello and welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Evan, an exercise oncology instructor, and today's conversation is on the role of movement in sarcoma in bone cancer treatment. The information in this video is for educational purposes only, and it's important to consult with your medical team for more in-depth guidance and advice. And of course, as always, following our conversation, stick around for some gentle movement. Before we get into what exercise can look like for patients diagnosed with sarcoma and bone cancer, I think it's first important to touch on why. Why is this exercise so important for these patients? Well, one study published in the Journal of Clinical Oncology details this statistic that adult survivors of childhood osteosarcoma are 5 times more likely than their siblings to report chronic conditions such as obesity, ischemic heart disease, and hypertension. Since we know that these conditions and many others can be improved with healthy lifestyle interventions, a need for exercise and physical activity is clearly demonstrated. Continuing on with why exercise is important, now looking at sarcoma patients specifically, let's first look at some of the negative aspects of both treatment and the disease itself that exercise can help to improve. First of all, there's the common side effects of chemotherapy: increased fatigue and anxiety, decreased quality of life and physical function, general deconditioning. It's known that these side effects can be rough on the body. For patients undergoing radiation, we also know that tumors with less blood flow are less susceptible to radiation therapy. And finally, for patients who undergo surgery, we know that this can result in long periods of recovery with minimal activity, contributing to overall deconditioning. Looking now at how exercise can help improve those negative aspects, we know that exercise has been shown to improve various general chemotherapy side effects. Secondly, we know that exercise improves blood flow and promotes angiogenesis, which is just the formation of new blood vessels, improving the effectiveness of radiation treatments. And finally, of course, exercise can improve the overall deconditioning from surgery and recovery. Looking now at bone cancer, once again, we're asking, why is exercise important? Well, we know that both chemo and radiation can damage or kill bone-building cells. We also know that radiation reduces blood flow to the bones, resulting in a higher risk of fracture. And finally, we know that hormone therapy presents a higher risk of osteoporosis development, as well as lowers testosterone and estrogen, which both play a key role in bone maintenance and growth. Exercise can help minimize those negative effects of treatment for bone cancer patients as well. As you can see listed at the top of the slide there, I have stronger muscles equals stronger bones. The key player here is a mechanism within the body called bone remodeling, where the stress placed on the bone from the pulling of connected muscle can signal bone building cells to become more active to essentially adapt to this mechanical stress. As our muscles become stronger, they pull harder on the bones, increasing this stress signal. And of course, as we stated before, we know that exercise increases blood flow, which delivers more nutrients to the bones and helps them become stronger. So we've looked at why exercise is important for sarcoma and bone cancer patients. Now we can dive into how to go about implementing exercise into your treatment, regardless of where you might be in your journey. First, looking at pre-treatment, the goal here is just to enter treatment as healthy as possible. Basic physical activity needs should be the focus here, and we want to keep things at a light intensity. Once in treatment, our focus shifts to mainly just minimizing those negative health-related side effects. While exercise is still on the lighter side, the activities themselves now start to shift into a more structured and programmed exercise routine. We start this phase still in that light intensity range, but as tolerated by the patient, exercise gradually increases into a more moderate range. Upon completion of chemo or radiation, the progression of both the exercise intensity and the patient's fitness level can continue to gradually increase until eventually active treatment is completed and the focus becomes lifestyle adaptations focused towards continuing the habit of exercise. With all of that in mind, we can look at some recommendations to ensure that our program is safe and effective. When starting an exercise program, it's crucial to include various types of exercises such as strength training, cardio, stretching, and balance training. We'll start with strength training, which should generally be light to moderate intensity. There's many methods and exercises that can be included to work different regions of the body. These can include body weight movements using resistance bands and weight training. This activity is what makes our muscles stronger. Cardio training is also crucial and should once again be at a light to moderate intensity. It's generally best to include low impact activities here that put less strain on the body. These can include walking, biking, and swimming. This activity improves our heart health and has been shown to have tremendous benefit in reducing many of the treatment-related side effects. Finally, there's flexibility and balance training, which are both crucial for those exercising with sarcoma and bone cancer. Stretching specific areas can help relieve tension placed on tumor-affected areas down the chain, offering pain relief, and both flexibility and balance training are essential in improving mobility and functional capacity. Finally, safety should always be considered throughout any exercise program, so here's a few things to keep in mind. First, tumor area and affected region should always be considered with each exercise. If something's going to bother that area or causes pain, it should be avoided. High impact exercises such as running or jumping should also be avoided, as they can put a lot of stress on weakened or tumor affected areas. Patients with bone metastases should avoid movements that include any twisting or excessive bending of the trunk in order to minimize any potential damage to the spine. All patients should always monitor pain levels throughout an exercise program, and modifications should be made when necessary to minimize pain or injury. And finally, always consult your doctor or care team before starting an exercise program. Every patient and every case is different, and they'll be able to give you the best advice and recommendations for what to avoid and how to stay safe. Thank you for being a part of our conversation on the role of movement in sarcoma and bone cancer treatment today. I hope the information we covered has brought you some clarity and comfort. Your health and well-being are always what matter most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now, let's transition into some gentle movement to further support your journey.
I'm Jessica, your exercise oncology instructor with Maple Tree Cancer Alliance. This is week 6 of the 12-week general program for neuro-oncology. Safety is our top priority in this program. Please exercise caution with all movements. If you are feeling off balance at any time, please sit and attempt the exercises seated. We are going to gradually increase the level of difficulty, so if you find an exercise that doesn't serve you, please go back to a previous exercise or wait until we do something that's better. All we'll need this week is some floor space. Let's get started. Begin standing with your feet about hip distance apart. Shoulders over hips so spine is nice and tall. This first exercise, we're going to do 3 sets, 30 seconds each. They'll be standing marches, so we are going to do opposite arms to legs. Right knee lifts as the left arm comes forward, and we'll switch. We'll do this for 30 seconds, and we'll start in 3, 2, and 1, begin. Knee lifts as high as you're able to lift up to hip height, and it can also go lower if that's where you're at today. Breathing here, warming up the body. About 10 seconds left. And go ahead and release. Shake it out. Go ahead and set yourself back up. And we're going to do another 30-second round there. And we'll begin. Remembering to breathe. You can go as slow or as fast as you would like here within this 30 seconds. About 10 more seconds left. And go ahead and release. Shake it out, take a moment. Set yourself back up. And then we've got just one more round of this for 30 seconds. We'll start in 3, 2, and 1. Last round. Keeping your spine nice and tall. About halfway there. Five more seconds. And release. Good. Shake it out. Catch your breath. And set yourself back up so that we are feeling nice and stable. Feet can be shoulder width apart or hip width if that's better for you. And we're gonna do some cross body reaches. So taking left arm over to the right, right arm to the left. We're gonna do 2 sets of 20 here, continuing to warm up the body and getting ourselves moving. When you're ready, we'll start with the left arm to the right, right arm to the left. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Release, shake it out. We've got just one more set of 20 there. Have a slight bend in your knees, so we don't want to totally lock out our knees. And we'll start with left arm to the right, right arm to the left. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Release. Great job. This next warm-up will be just some overhead reaches here. And we'll also do 2 sets of 20 for this one as well. When you're ready, we'll start. We'll reach up and then the other arm. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Release, shake out your shoulders. We've got just one more set of 20. Go ahead and set back up, and we'll reach up with one arm, and then the other. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Release. Great job. Hopefully we're a little warmed up by now. Let's go ahead and bring our feet a little bit wider and squat down ever so slightly. So knees bend, hips back. Make sure that we feel stable here, so bring your feet wider or closer together until you find your stability. Arms will be up at our chest, and this will be our starting position. We're going to do some forward punches, and we're going to do 20 of these. So left arm punches out in front of left shoulder, and right arm punches out in front of right shoulder. When you're ready, we'll start. Punch left, punch right. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Go ahead and stand up, shake it out, catch your breath. Deep breath in and out. This next one, we're also going to be in this half squat, this mini squat. Arms at our center position, and we're going to do some uppercuts. So, punching up in front of the body. We're also going to do 20 of these. When you're ready, we'll start with left punch up and right punch up. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Go ahead and stand up, release. Our next exercise will be some cross-body punches. So taking our left fist over to the right, and then right fist over to the left. Again, we're gonna be in this half squat. So spine is up tall, core is engaged. When you're ready, we'll set up. And we'll take our left arm, punch it to the right, back to center. Right arm, punch to the left, back to center. That's 1. Keep it going. 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Stand up, shake it out. Great job. So now that we've gone through all of those punches, we are gonna do it all again twice more. So let's go ahead and find our half squat. Bring your hands to the center, and we're gonna start off with those forward punches. So taking left fist straight out in front of left shoulder and bringing it to the other side. When you're ready, we'll go ahead and start. 1, 2, keep it going. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Stand up. The next one is our uppercuts. So coming back down into our half squat, arms up. And once you're ready, we'll go ahead and start with one arm, bringing it up, and the other arm. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Go ahead and stand up. We've got our cross body punches next. And keep in mind with these punches, you really get out of it what you put into it. So you can always make it more intense, or you can lower down the intensity depending on how much you put into it. So let's go ahead and come down into our half squat again. Arms up, and we'll start with the left arm, punching over to the right, to center, right, to the left, and center. Punch to the right, center, left, center. Good. Keep it going. This is 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Stand up. Great job. We've got just one more round to go, cycling through all of those different punches. Once you're ready, go ahead and come back down into our half squats. Straight punching out. These forward punches. We're going to do 20 more of these. Go ahead and begin. Good. Keep it going. 3, 4, 5, 6, 7, 8, 9, 10, halfway, 11, 12, 13, 14, 15, 16, 17, 18, 19, last one, 20. Stand up, shake it out. Just 2 more to go. Catch your breath, deep breath in and out. Find your half squat again. Arms up. We're gonna circle back to those uppercuts. When you're ready, go ahead and begin for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Stand up, catch your breath. Just one more to go. Let's go ahead and find our starting position again. Arms up, and we'll punch to the right and to the left for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Last one. Stand up, shake it out. Great job. If we are feeling a little off balance today, I encourage you to find a table or a chair to rest your hands on. If you are feeling pretty good about your balance today, we can go ahead and take our hands to our hips. And what we're going to do is step back with one leg, balance on the ball of your foot so our heel stays lifted, bend into the front knee. And then we are going to stand back up, step back with the opposite leg, bend into the front knee, step up. That will be our next exercise, and we'll do 3 sets of 20 here. When you're ready, stepping back with one leg, bend into the front knee, step it up. Switch legs, and up. That's 1. Keep it going. 2. 3. 4. Keep your spine tall. Core engaged. 5, 6, 7, 8, 9, 10. Halfway there. Make these big step backs. 11, 12, 13, 14, 15, almost there, 16, 17, 18, 19, last one, 20. Deep breath in and out. We've got 2 more sets of 20 there. If you do fall and lose your balance, just go ahead and pick right back up where you left off. When you're ready, go ahead and step back and up. Step back with your opposite leg and up. That's 1. Keep it going. 2, 3, 4, 5, 6, 7, 8, 9, 10. Halfway. 11, 12, 13, 14, 15, almost there, 16, I know we're feeling it, keep it going, 17, 18, 19, and 20. Come to your standing, deep breath in and out. Deep breath in and out. One more time. Deep breath in and out. Good, great job. We've got just one more round to go. Find your standing position. And when you're ready, take that big step back and up. Opposite leg, step back and up. 1, keep it going. 2, 3, 4, 5, 6, 7, 8, 9, 10, halfway there. 11, 12, 13, 14. Just a little bit more to go. You can do it. 15, 16, 17, 18, 19, last one, 20. Release, come back to standing, shake it out. Great job. Deep breath in and out. 2 more times. Good. This next one, we are going to do heel lifts and down. Hands can be on our hips or a chair. We are just going to do 3 sets of 10 here. When you're ready, find your position. Lift your heels up, balance on the balls of your feet, and exhale, release for 1. Squeeze your calf muscles up and down for 2. Come up, down for 3. Keep it going. 4, 5, halfway. 6, 7, 8, 9, and 10. Take a moment, shake it out. We've got just 2 more sets of 10 there. When you're ready, find your position, and we'll lift up and down for 1, up and down for 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. Good, shake it out. Last set of 10, almost there. Set yourself back up and lift your heels and down for 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. Great job, shake it out. We are going to transition to the floor next and do some nice gentle floor stretches. If you have a mat, you can certainly use a mat, or if you have just a nice comfortable spot on the floor. Go ahead and start in a seat. And once you're in your comfortable seat, let's take our right arm up overhead and reach it towards your shoulder blades, finding a tricep stretch. So you can either gently press your elbow back here, or if it's more comfortable, you can bring it up overhead. We'll hold this stretch for a couple breaths. Good, and then we'll switch to the other side. Find your stretch here, and then we'll hold. Good. Go ahead and release. We'll come to a child's pose. So start on your knees. And big toes touch. Knees can be wide or they can be close together. Start to slowly walk your arms out. And if you're able to, rest your forehead on your mat. We'll hold here for just a little bit. Make sure that we're breathing. Deep breath in and out. Inhale, start to walk your palms back towards you, coming up to a seat, and then we'll transition onto our backs. Slowly lying down, and we'll come onto our left side. Go ahead and stack your knees and your arms on top of each other, and inhale, open up your right arm, coming into a twist. You can either gaze out over your right shoulder, or if it feels better, you can look up at the ceiling. And we'll hold this for just a little bit. Start to bring your knees back through center, and we'll roll all the way over to the right. Stacking knees, stacking arms. And then inhale, open up your left arm, coming to a twist on this side. And we'll hold for just a little bit. Bring your knees back to center. And we're going to keep the soles of our feet on the floor and take your right ankle over your left knee. So we're looking for a stretch in our right hip. And if you feel it here, you can stay here. You can gently press into your right thigh, or you can lift your left leg up and clasp your hands behind your left thigh or left shin, pulling your legs gently closer to your chest. And holding here for just a moment. Go ahead and rest your left foot down, right foot follows, and we'll switch legs. Take your left ankle over your right knee, and again, you can stay here, gently press into your thigh, or lift your right leg up. Find where you feel your stretch best, and we'll hold for just a moment. And release one foot down and then the other. We're going to come all the way onto our right side. You can either be on your forearm here, or you can rest. Bring your legs as straight as you can. Bend your top knee and take hold of your foot or your ankle here. Gently bring your heel closer to your hip. And we're looking for a stretch in our thigh. We'll hold here for a few breaths. Go ahead and release, and we'll switch sides. Bring your legs straight, bend into the top knee, and reach behind until you grab hold of your foot or your ankle. Gently squeeze closer towards you until you feel your stretch. Go ahead and release, and we'll make our way to a seat. That is it for this week. Thank you so much for joining me, and I'll see you next week.